All right, let's get to our conversation tonight. Today is International Workers' Day, and as Nigeria marks this year's edition, one of the major sectors in need of an urgent rescue is the medical sector. Chairman of the Lagos State branch of the Nigeria Medical Association, Dr. Babajide Saheed, has raised an alarm over what he described as a collapsing system losing its best minds daily, otherwise known as JAPA, the mass migration of skilled medical professionals. Dr. Saheed also listed key demands, including the payment of outstanding arrears, welfare reforms, and improved working conditions. Meanwhile, in a move to address shortage of medical personnel in Nigeria and increase student enrollment, the federal government has allocated 100 billion naira to upgrade and rehabilitate infrastructure in 18 selected medical schools across the country. The Minister of Education, Dr. Tunji Alausa, made this announcement during the inauguration of the Monitoring Committee on the High Impact Intervention Project for Medical Schools Rehabilitation. This effort is expected to ultimately address Nigeria's healthcare workforce shortage, providing much needed relief to the country's medical sector. Joining me tonight to elaborate on this issue is a professor of pediatrics and neonatology, University of Pennsylvania, Iyala Peterside. Happy International Workers' Day to you, Prof. Welcome to Politics Tonight.
Good evening, good afternoon from here, but good evening to Nigeria.
Right, thank you so much for joining us this day. 4 decades of celebrating May Day. I want you to talk to us about the significance of this day, significance of this day in the lives of workers, especially health workers.
You recall that for a long time, workers were really fending for themselves individually until not too long, I think maybe in the 60s, the unions became a thing. And since then, workers have wielded some power and policies have been directed to improving workers' conditions. And I think that for most places, you can point to improvement in workers' well-being, even though in some places there have been some regression because of more conservative policies that focuses more on entrepreneurs rather than the workers. But in all, I think, especially for developing countries, the emphasis on workers has paid off.
And I also want you to speak to us about, what it takes to be a productive worker in Nigeria. I know you don't practice here. I'm not sure, precisely a health worker, whether in the private or public sector, compared to where you practice, which is the U.S.
I trained in Nigeria at the University of Ibadan, and I practiced in Nigeria, Port Harcourt especially, for a long time before I left. The healthcare worker in Nigeria is one of the most dedicated workforce you can find, given the limitations of both training, service, and recompensation. And I think that having come abroad and seen the difference, we must give a lot of credit to healthcare workers in Nigeria for some of the selfless services they provide in the face of very limited resources, and also in some places some limited encouragement for what they do. And I think that there have been big shortfalls not only in policy but in implementation of policy with regards to the government and what they say versus what they do. And so I think those things need to be improved across the board. When you talk about healthcare workers, you're obviously including doctors, nurses, all the ancillary staff that work in the healthcare system, and not just saying doctors alone, but everybody.
And interestingly, one thing Mr. President has said is that doctors will not go on strike under his watch. And I think so far he has kept to that premise, supervised by his Minister of Health, Professor Ali Pati. But our reality is that, over 16,000 Nigerian doctors have left the country in the last 5 to 7 years in search of greener pastures abroad. This is a statement credited to Ali Pati, the Coordinating Minister of Health and Social Welfare. It's so bad that, it has created a doctor-to-population ratio of 3.9 per 10,000, which is far below the global minimum standard. There are different factors. Some say limited opportunities for career advancement. Some say lack of research funding. Some say lack of specialized training within Nigeria. How bad does it look?
It's bad. It may get worse. It's bad because Nigerians are dedicated to the country. I can tell you, for instance, my graduating class of 1985 from Ibadan, 50% of us are outside the country, which is a major brain drain. And not only is the country losing our services, but the investment in our training is being lost all over the world. I think that um, there are clearly moves by countries in Europe to attract um, countries from third world countries, especially Nigeria, because it costs less for them, and we are good doctors when we travel, and our dedication is never in doubt. So I'm worried that except something is done quite seriously, that the trend will get worse.
So the question is, what needs to be done? Because I mean, the Minister of Health has a beautiful vision. He has shared with me on several occasions on this program. Professor Alipati sees an opportunity under President Bola Tinubu to create new policies to better manage Nigeria's healthcare workforce. Mr. President has also seen the need to fund the ministry. But in terms of policies to better manage the healthcare sector, what will these policies be?
So the issue of brain drain is guided by two theories. One is a push from the country you're coming from. What's pushing you to leave? The other is the pull. Where are you going to? What's the pull to get there? In both cases, the pull and the push theory for healthcare services and healthcare workers is in one direction.
Okay.
And there are enough disadvantages to being a healthcare worker in Nigeria, and there are enough advantages to be a healthcare worker abroad. So that direction has to be reversed in some way. The easiest way to reverse it is to reverse the push. Because I can tell you for a fact that when you are an immigrant doctor here, the first time you come around, you're happy, you want to be here. But over time, you really want to go home. I can tell you that most doctors in the diaspora, if you poll them, 60 to 80% want to go home. But the reason they're not going home is because the conditions at home are not conducive for coming back home. There are countries that have reversed that trend. India is one of them.
Well,
They have trained a lot of
in the last few months, we've seen some of them come back home to practice. How do you juxtapose both realities?
I think everybody wants to come home. Most people want to come home. There's very few people who don't want to come home. But the problem is that, again, the push is always once you've achieved something here, you've settled down, you've done what you can do, is to try and get back home. Not only because it's the best place to be, but also you think you want to contribute. Most times, though, people come home and they are faced with disappointment, not just in salary, not just in working environment, but in security and remuneration. And so a few people come home hoping to stay, but then run back here. And I think that's the push-pull effect. We need to improve the conditions in Nigeria that make people leave, because those same conditions will make people come back if they're improved and stop people from leaving. But it's not here. The convenience of staying here wears off very, very quickly. So if you have enough impetus to go home, most people would rather go home.
And one other reality is that, I mean, the country loses significant investment made in training these professionals because the max exodus out of the country means the citizens never get to enjoy their services. But yesterday, the federal government, through the Tertiary Education Trust Fund, has announced a 100 billion naira investment to upgrade medical education in 18 universities across Nigeria. I'm wondering, to what extent will this go in reducing brain drain in that sector or in the country?
Every little helps, and I congratulate the government for what they're doing. Most of the time, there's a gap between policy and implementation in Nigeria, and that has trailed us for many, many years. In 2016, they launched the National Health Policy, and if you look at that health policy, in theory, it was a brilliant policy, but look at the implementation of that healthcare policy. It's been lagging behind, it's been faulty, it's been plagued with problems. Now we have this. I think that my alma mater was shut off from NEPA light a couple of months ago. Can you imagine not having light and having primary university teaching hospitals not having light because they haven't paid NEPA bills. Those are the kind of things that make working in Nigeria onerous and making people like me and others think, why do I want to go out and deal with this when I can just stay here and take care of patients that I love to take care of? People don't want to deal with those extraordinary things that don't play into patient care and well-being. Let's look at the implementation of a national health insurance scheme. How many years have we had that? What is the recruitment on that? Those are also things, gaps in policy and implementation, not just in the healthcare system, but all over Nigeria, causing lots of
All right, Prof.
difficulties.
I'd like for us to expand this conversation, but when we come back, we'll continue this conversation. But quickly, I need to make an announcement. In celebrating the International Workers' Day, we'll bring you a documentary on Workers' Appreciation by Dr. Biola Salami. After the break, viewers can join us on our other platforms. Please stay with us, everyone.
Stay ahead with the biggest news stories. Go beyond the news headlines. Experience impactful investigations. Enjoy resourceful news coverage in real time. TVC News at 7 and TVC News at 10 p.m. Live every day on this channel. TVC News. First with breaking news.
It is Workers' Day, and so tonight we're addressing the brain drain in the health sector. And I've been speaking with a professor of pediatrics and neonatology, University of Pennsylvania, Professor Yala Dat Peterside. Prof, thank you so much for staying with us on Politics Tonight.
Thank you.
All right. So you're Professor of Pediatrics and Neonatology, and I'm aware that this is a branch of medicine dedicated to the medical care of infants, children, and adolescents. I know that it encompasses a wide range of aspects. You look at preventative care, diagnosis and treatment of illnesses and injuries specific to childhood. I want us to shift our attention to a very important part of Nigeria's healthcare system, which is reducing maternal mortality and morbidity. What are the primary causes of maternal mortality and morbidity, and how can they be effectively prevented?
That's a big topic. I think that obviously the first thing is universal coverage. We need to provide healthcare where they meet the people where they are. So even though you quoted a good number, 3.8 doctors for every 10,000 citizens, which is 38 per 100,000, the WHO recommends 166 per 100,000. Even the 38 per 100,000, unfortunately, are concentrated in urban centers. So the rural centers rural areas do not have as much doctors as you see, say, in Lagos, Port Harcourt, or Abuja. So there's a major drop-off. And so availability and universal provisions are not there. So we need to make sure that the healthcare is provided to the people where they can meet. There's a statistics that says that for citizens that don't have secondary education, antenatal care is provided by professionals in only about 12% of cases. Those that have secondary education, antenatal care is provided by about 80% of trained staff. So there's a big discrepancy in that. And most of our population, as you all know, are not that educated. We need to find a way to make sure that in the rural areas, not just the urban centers, that healthcare is not only available, it's accessible, but also it's got to be affordable.
Affordability. I see. You know, it's a very important conversation because Nigeria currently has the 4th highest maternal mortality rate globally, with a staggering 1,047 maternal deaths per 100,000 live births. So this is something the Ministry of Health is trying to change. The NHIA, overseen by Dr. Ohidi, has put together some initiatives. But first, based on your experience, how does access to skilled birth attendants reduce maternal mortality?
I think that if you have somebody who knows what they're doing, who has been trained in delivery, they don't have to be a doctor.
Okay.
Who has been trained in recognizing normal from abnormal. Most mothers who deliver can deliver at home if everything goes well. It's recognizing when things are not as normal as they
Right.
are, and then making the right decision, either to interfere or to move the patient along to a more acute, a center that can take better care. Unfortunately, when these parents are the patients are delivering without proper supervision, they don't recognize when things are going wrong, and so before they move, you know, it's catastrophic. So health workers who are trained in delivery, whether they are men or women, whether they are just illiterate but have the skills, will improve maternal mortality dramatically.
And that's for
And having a system of
professionals.
referral,
And that's for
excuse me, having a system
professionals.
of referral, let me finish.
Right.
Having a system of referrals where those health workers can quickly move patients from point A to point B when the interventions are not working will make a big difference.
Having talked about professionals who must know what to do, what role does antenatal care play in preventing complications during pregnancy?
Fantastic. I mean, it's even in America, there are people who don't get antenatal care either because of poverty or drug addiction, and there's no question about it. Even in a place like this, if you do not have antenatal care, complication rates are higher, mortality rates are higher, both for the mother and for the child. In a place like Nigeria, antenatal care actually is centered around the woman,
Yes.
teaching her how pregnancy should normally progress, giving her and empowering her to recognize when things go from A to B and what to do with that, and then presenting herself when she's in labor or when she notices that things are not working well, helping her with her nutrition, helping her with being ready to take care of the baby by breastfeeding or caring for the baby. So you don't have to have an ultrasound, but somebody who understands, who can really empower the pregnant woman not only to take care of herself, but be ready to take care of a baby, is invaluable in a healthcare system.
I'm asking all this question because NHI is now spearheading what they call a national free C-section program paid for by the federal government. And interestingly, also, we've all agreed in this part of the world that in Nigeria, we do not lack policies. We do not lack initiatives. What we lack is proper implementation of these policies and initiatives. So from your own end, how does government ensure the success of most of these programs?
I'll give you an example. In Rivers State, during Odili, Dr. Odili was governor of Rivers State. He made a pronouncement that any woman who was brought to the Central Teaching Hospital for cesarean section was free. And that was a fantastic declaration. It made sense. What did not make sense was that there was no preparation for the inflow of patients who had to come. So there was a big gap between what the governor announced, what the hospitals were seeing, and the additional supplies and support that the hospital needed to carry out this very laudable policy by the governor. What then happened was that women were coming from distant areas to the teaching hospital for cesarean section as promised by the government. The hospital was not ready, so mortality became very, very high. And of course, women then associated coming to the teaching hospital with increased mortality. They were coming to the teaching hospital without preparation. Nobody warned the hospital before they came, and the outcomes were terrible. The result was that a well thought out policy pronouncement without proper implementation and supervision became a nightmare, and nobody wanted to go to the teaching hospital to have a baby because in their minds, you go there, you either die or your baby dies. So that's the breakdown between policy and implementation that has plagued us all over the place. If you set up a policy like that, you have to back it up. You have to make provisions for the increased flows. You have to back it up because people are going to take your word for it, show up, and you're not ready for what you're promised.
And also, Prof, I mean, based on your years of experience, how can government and international organizations work together to reduce the socioeconomic barriers that contribute to maternal mortality and morbidity?
It's not simple, but it means that you have to talk to all stakeholders, starting from the villages, understanding the barriers to people using the healthcare system. You have to provide an environment that's welcoming. You have to show data. You have to look at data and know what is going on. I went to a hospital in Nigeria a couple of years ago, and I took this CMD and I said, "How many deliveries do you have every month in your hospital?" He did not have that information. I asked him, of those deliveries, what times do you have your peak deliveries? He did not have that information. I asked him, okay, tell me, how many doctors you have at any given time? Most of the doctors are working 9 to 5 or 9 to 2 o'clock and they go home, and they have a skeletal staff at night. If most of your patients come at night, what's going to happen? So we need to not only have good policy, we need to drill down, collect data, do some research, and know what we're really working against. Because it's a simple thing if you have data and you know what you're doing. I work at the University of Pennsylvania. We have 12 NICU centers. If I pick up my phone and open an app, I will tell you how many patients are in each of the centers, how many beds they have. I will move nurses or doctors from one center to the other because of shortages without needing to talk to anybody, because I can see in a flash what my situation is and where the pressures are going to come, so I can take care of it. So it's planning, it's thinking properly, and getting the people who practice the art to be involved in the planning and implementation of what you're trying to do.
And because you had talked about the importance of proper care for pregnant women, I would like you to help us with, the benefits of improving nutrition for pregnant women.
The Nigerian nutrition is robust. There's poverty, all right, but most people can forage for what they want. The pregnant woman especially needs a lot more calorie supplies, better nutrition, because of the burden of pregnancy and the needs to not only nourish yourself but nourish the one. We need some areas have provided supplemental nutrition for pregnant women in terms of food, vitamins, and especially training on how to prepare those foods. We need to go back there. I think that emphasis on primary care is good, but they have to train. They have to provide the staff to make sure these women who are producing our future are well taken care of, so that the baby, and there's a correlation between the woman's nutrition and the baby's outcome. Right. So a malnourished woman will not produce a good baby. It's very simple. Make an omelette with bad eggs, you're going to get a bad omelette. So we need to pay attention to what the woman looks like before she produces a baby, because if she's not healthy, the baby is not going to be healthy.
Absolutely. And still talking about the free C-section, that initiative is aimed at reducing the high maternal mortality in the country. And from the conversation I have had with the minister and the NHIA boss, only women in public hospitals registered under the National Health Insurance Scheme are eligible, which means that those registered in private hospitals are not covered, cannot benefit. My last question to you this evening is, how can family planning programs help in reducing maternal health risk? And what barriers do you think women face in accessing contraception?
Clearly, the decision to have a baby is a very private one within a family. However, there's clear data that the more babies you have, the higher the risk for subsequent pregnancies, risk of malformations, chromosomal abnormalities, risk of bleeding from postpartum hemorrhage, risk of hypertension as you get older, preeclampsia. So whilst it is a private decision to be made, citizens have to look at some of that and take heed. In addition, it's not like previously, where the bigger your family, you could send them to the farm and have an advantage. Now you have to take care of the children when they're born. So you have to also be careful how many children you you provide so that you can take care of them. So those
All right,
factors affect how people think about the family.
All right, Prof.
And
I'm sure we would have this conversation, or we'll continue this conversation some other time. But so far, it's been educative and inciting. Thank you so much, Professor Yala Dad Petersard, Professor of Pediatrics and Neonatology, University of Pennsylvania. Thank you so much for your time on Politics Tonight. I appreciate it. Thank you so much.
Thank you very much, and happy Workers' Day.
Happy Workers' Day to you. Thank you. And thank you very much for watching, everyone. That marks the end of today's episode of Politics Tonight. But before we go, let's tell you that the views and reactions of our resource persons are theirs and have no connection with TVC News. Meanwhile, you can watch the repeat broadcast of this episode at midnight. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajumo KWO using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumo Kiolatuju. Happy Workers' Day.